So this is diluted Belotero. So we took Belotero. What do we take? What were your 1 to 10? Okay. And so here this is so. And then when we get into this, there are micro needles. Can everybody see the needles? And so it's the only product on the market. And I have lots of needling systems. I always tell people I have lots of big systems, little systems, but this is the only one that can deliver product. Okay? And so Belotero becomes one of these really great products because it is a soft filler. Okay? And you can do this with Xeomin, and you can do it with anything, really. You dilated this with, you just dilated it with saline, right? Just saline. I'm going to start over here, and I'm going to do a couple little zaps on her neck. How does that feel? Nothing. So it feels like nothing. Okay? So I've already treated this part of her neck, and it'll be pink for about 10-15 minutes, and then that'll go away. Okay? So we'll turn a little bit this way. And she will notice a very nice change here in this area of her skin. And you can see, and you can see we've used probably half of it already that was in there.
So it's supplied as an empty vial?
Yeah, so they get it comes as an empty vial, and then you can put anything you want in it. Now I always stress I like things that are sterile to be put in it. That's your neck.
1 to 10.
On a scale of 0 being no pain, 10 being the worst pain, what was it?
0.
0. Okay. So on Tiffany, we're going to be doing her forehead. Same thing. Meso Belotero to the forehead to reduce these lines. Okay. 1 to 10. And so I think one of the things that's important here is I can spend an hour doing this, or I can spend 5 minutes doing this. Yeah.
With the Belotero, would it diffuse that way? How would you see the effect?
Well, she'll see the effect. She'll see a softening of some lines she had up here, and she'll just see a nicer skin quality. So we're going into papillary dermis, and you do. That's it. Okay, so did it hurt at all?
Not at all.
There you go. And again, you can see we used probably a third or half of what I was given. Isn't that cool? I mean, it's so simple. Okay, it's such a simple concept that I wish I invented it. So I'll start over here, and I like to pull down. Okay, so I'm at. That's what it feels like.
That's it?
She's had Ulthera, so this is nothing.
Is that bleeding normal, Dr.
Yeah.
I have
She has dermographism, so she actually turns red.
Because I was wiping my neck down
with the alcohol. So
that is like nothing.
No anesthesia, no nothing.
And do you have to limit the passes you make?
No. So since we've not done this before, I will only do one pass, and you'll see some smoothening of these lines over the next couple days. And I'm going to go back over the whole trachea area.
You probably could go all the way to the back of the neck too, like for men.
That's it.
That's it?
That's it.
Okay, how much did you use? Did you use all of it?
Almost all.
Wow.
And Belotero seems to work exceptionally well. I know other doctors have done Juvederm and Restylane. I really use it for Belotero. That's what I do. And you can do Xeomin, Botox, Dysport. It's easy. And again, if you want to treat here and you don't want to stick, we can treat here really well. Okay. A lot of us get nervous here. Take this and do Meso Botox. So Meso Xeomin, Meso Dysport, I don't care what you call it, with Aquagold. If you go to Asia, and I go to Asia a lot, I was first introduced to Meso Botulinum toxin in Asia, and I'm like, you're crazy. They're doing like 100 needle sticks. Okay, this is so much simpler, and it's a novel thing that we've never thought about in this country, but around the world, this is what people do every day. I don't think there's any area I wouldn't do. Yeah, you can do around the mouth. Yeah. But I think you can do. I wouldn't hesitate. I mean, I definitely wouldn't hesitate here, here. I wouldn't hesitate up there. I wouldn't. If somebody's got some dynamic movement and they want to just soften it a little bit, you can do it anywhere.